Hi, my name is Kim Collison-Riss. I am a licensed family nurse practitioner in Washington State. I also have a second master's in complementary alternative medicine. And today I'm here to talk to you about homeobotanical therapy. It's a really exciting type of therapy that is designed to boost the immune system in individuals. This was created by Dr. Brian Murray from New Zealand, and he in 1984 really wanted to figure out a way that patients could blend the best of both worlds with both homeopathy and scientifically prepared botanicals. One of the greatest difficulties was that this type of naturopathic care was very expensive, and a lot of people just didn't have access to it because they couldn't afford it. So what he did was he was able to work with other naturopaths and scientifically blended the principles of homeopathy and botanical medicine and created these these concentrated forms that could be diluted down and succoused to treat a variety of different types of symptoms that would show up. And what they did was they were able to trial these on the patients that were coming into their clinics. These botanicals had multiple mixtures in them, so there were more than 2 or 3 different types of scientifically prepared herb. And what they did was they were able to add it to a base formula. Sometimes that base formula was made out of an alcohol type tincture of distilled water and pure alcohol, or was made out of acetic acid and glycerin and distilled water, and blended that. And those were then succoused by pounding, and that helps activate and potentiate the herbs that were together. And then the client would take them in a drop formula several times a day. He was really impressed with the success, and patients, even though these therapies are designed to kind of not be as potent and strong as modern medicine, they have the same principles as our foundational medicine that used to be made from plants before synthetic trademarked equivalents were introduced into the market later in the 40s and 50s. What I like about homeobotanical therapy is that it is tailor-made for the individual person, and the formulas are actually labeled A through Z, and then 1 through 22. And actually there's more than 40 formulas. In fact, there are many formulas beyond that that are actually combined with some of the native plants of New Zealand that the natives used to treat people for centuries. What I like about scientifically prepared botanicals, the homeobotanicals, is that we really just aren't going to come up with the same complaint, which is this formula doesn't have the same chemical constituents in it, and the percentages are going to vary. They're going to be the same every single time. And then what we do is we blend them. So say an I formula is for immune boosting and infection control, is oftentimes combined with an A formula, which would be for allergies, and would also potentially be combined with a C formula, which is for colds and catarrh, when you get that really thick mucus. And that person might take those drops anywhere from 3 drops to maybe 9 drops 2 to 3 times a day to help boost their immune system, help their body become able to fight off the effects of those allergies. And patients report a lot of symptomatic relief. Now, I know that these have not undergone double-blind testing, so many skeptics, and myself would have been included, would say, well, how can this be effective? But the Herbal Energy Center that creates these products had questionnaires and assessments before and after, and followed each patient. and they found that indeed they were valid and they did work. And when you really look at the cost, maybe a 1 to 3 formula, depending on the amount of need, might only cost between $10 and $20 as compared to, you know, $50-$60 for particular medicine, and sometimes they're higher than that. Only licensed homeobotanically trained people are allowed to prescribe these formulas. They are not for the lay public, and these formulas are generally given in a 1-month formulation, and a person would come back and be reassessed, and oftentimes the primary symptoms they came in with have abated, and sometimes there are no other symptoms, and other times there might be something else that pops up. Our bodies are interesting when we rebalance one system. Things that are underlying may rise to the top and be apparent. These formulas are gentle enough for children and infants and adults and frail elderly, and a clinically trained homeobotanical provider prescriber can help alleviate symptoms, and at the same time a patient can enjoy renewed health. In addition to these formulations, they have very little side effect profiles. In fact, very few are ever reported because the formulations are so dilute. What's neat is in the concentrates, you can take a look at them and you can actually see the little floating matter that's in the material. Unlike homeopathic medicine, where you really can't see the difference, and they're so dilute. These are actually can be, you know, broken down and seen in the lab that the different constituents work together. I am very surprised and amazed, and just so happy to add that to my repertoire. I practice both I practice integrative medicine, which blends the best of Western medicine and then the best of evidence-based folk medicine. So when you are looking for a provider to maybe help you with some long-standing health issues, and you are wanting maybe a more naturopathic approach, you might ask your integrative medicine or naturopathic provider if they are familiar with homeobotanical medicines, because they really can add to your health care and improve your health. This is Kimmer Collison-Riss, licensed family medical prescriber, signing out on homeobotanical medicines.